So postpartum depression and postpartum anxiety are part of like an overall umbrella term that we now refer to as PMADS, or postpartum mood and anxiety disorders. This is a commonly used term to refer to that mental health disorder that's experienced either during pregnancy or after having a new baby, adopting, or experiencing, honestly, a pregnancy or infant loss. It is not just postpartum depression or postpartum anxiety. It is peripartum, peri-pregnancy. It kind of encompasses a bigger picture, and it can actually encompass the picture for at least up to a year past that delivery point or adoption point, or the kind of significant change that occurs in your family dynamic as a result of a pregnancy or a newborn. It's often, symptoms-wise, can be different for different people. Sometimes it's significant anger or rage or upset. It may also be significant depression. You just don't feel excited. You don't feel like you can do things. You feel like a drastic change has occurred that you can't backtrack from. It is about 1 in 5 women will actually be diagnosed with peripartum mood and anxiety disorder, which is a lot more than people really recognize. And it is just as much of a health condition as diabetes or hypertension would be. So the treatment, it can be variable. Many people will experience or have a higher risk for postpartum mood and anxiety disorders related to poor social support, stressful life events, traumatic delivery, or traumatic pregnancy loss or infant loss. If you have difficulty getting pregnant, because we talked about this, it's not just postpartum care where PMADS occurs. And then things like preterm deliveries, time in the NICU, these can all increase those risks. So it's really important to recognize that that is a problem that we can actually help with as long as it's kind of brought to us. It is something that we want you to reach out to for, especially if it's bothering you. Like I said, up to a year after that kind of inciting event, you may experience these symptoms. So just because it doesn't happen that first 6 weeks, it can be 3 or 4 months later when things are drastically different. Treatment can be as things like therapy. Therapy is a really helpful option. Talk therapy or group therapy can be really helpful, especially around things like pregnancy loss, where understanding and having a community that can support you in a similar way who understands what you're going through, as well as medication treatment. Usually we want to have a conversation about it. If you had a history of depression or anxiety, there's sometimes an opportunity to restart a medication or adjust medications you might have already been on, or get you referred to either a psychiatrist or a therapist. In our area, we have we have something called Postpartum Support Virginia, which is a group of people in the area who help with that postpartum or support or care, and it can actually help with the prenatal option as well as a group called 7 Starling, which is virtual therapy, which is a nice opportunity for patients, particularly when you have a newborn at home and you're trying to find time for yourself to shower, but you can't really find time to yourself to go to an appointment. This is a good chance to have a therapy appointment to address some of the concerns there, and sometimes even start medications.